It's a heterogeneous disease. There are several clinical indicators that may inform us as to how our patients are doing on treatment. We always test for certain cardiac biomarkers such as troponin and BNP levels before we start them on therapy. That can help us understand the severity of the disease. Folks who have normal labs are likely to be at an earlier stage of disease or less sick than those who actually have abnormal labs. But one of the most important clinical features is how the patient is feeling, which is probably the most important demarcation for us when it comes to informing patients about how the disease is progressing. We really still rely on patients' clinical features and how they're managing the disease, because once we've identified that they have TTR amyloidosis, we may be doing things for the management of the heart failure differently than we would have done otherwise. And if they are feeling better clinically, along with assessment of their well-being using Kansas City questionnaire or more objective evidence with the performance of a 6-minute walk test, those are also important clues to understanding of how well patients are doing once they've been diagnosed with ATTR-CM and once they are on therapy.
Indication and important safety information. Indication: Attruby acoramidis is indicated for the treatment of the cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions: diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests: mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations: pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.